Dr. Kelston Ellis is putting bioethics at the center of everything she does in medicine. Ellis became committed to the discipline while working on her master's in bioethics at Kansas City University of Medicine and Biosciences. Bioethics is now shaping her future as she pursues a career in pediatrics and palliative medicine.
That's where the uncomfortable parts of medicine exist sometimes, is when you're dealing with end-of-life or life-threatening illnesses, and what should we do? What ought we do, not just what can we do? And I think that that's continued to be a theme throughout my medical career. Having that education very early in my medical training laid an incredible groundwork for me to build on.
The Center for Practical Bioethics helped build that foundation for Ellis through its ethics education partnership with KCU and its mentoring opportunities. From the early days, the center has made ethics education a cornerstone of its work, using information to empower medical students, clinicians, patients, and their families as they grapple with challenging healthcare situations.
As a healthcare provider, it's very important to have access to ethical expertise. We're faced with ethical issues on a day-to-day basis. Not many of us have the experience, so the center's position in providing the resources and the expertise is extremely important.
In the current environment, those efforts are more important than ever. The volume of available information, the rapid development of new technologies, it's all increasing the need for ethics education and intensifying the challenge of making it accessible to healthcare providers as they confront complex issues.
I can't imagine the Center for Practical Bioethics continuing to exist and fulfill our mission without a highly significant part of our resources being invested in education. It's always teaching, it's always learning, and the center will always be about that.
The education efforts start at a foundational level. The center works with area medical and professional schools to shape ethics education programs.
The Center for Practical Bioethics helped the university revamp our curriculum for all 1,200 of our medical students. And that's really given our students a great foundation for which to grow on.
Center staff play a role in the classroom, teaching in medical and allied health professional programs. They also provide practical training in the field for young scholars. For mid-career professionals, the center responds to the needs of clinicians and fills gaps in ethics education so that healthcare providers are better equipped to deal with the real-world situations they encounter. The impact is tangible for Dr. Lorraine Duncan, an emergency room physician at Centerpoint Medical Center and a member of the hospital's ethics committee.
The way they impact my patients is by teaching me so that I can take better care of them. Teaching my staff is an extension of me to take better care of my patients. And it's all about, at the end of the day, what's best for the patient.
Increasingly, the center is using technology to expand its reach. This is transforming training opportunities for clinicians, including those involved with hospital ethics committees.
At the center, we're adopting some new technologies that are extending the reach of our resources and allowing users from all over the country to access those resources when they need them most.
What a great boon it is for someone to be able to remote in to a webinar or a seminar and get the education that they may be missing or get the education that they may be looking for so that they can help their patients and their families where they are.
Anticipating emerging issues, identifying unmet needs, engaging in discussion with providers, and developing educational opportunities that address the pressing issues of our day. That's the focus of the center through its Bioethics Leadership Fund. The fund launched in 2018 as a way to recognize the contributions of the center's founding leaders. It supports a wide range of training programs for healthcare professionals as well as the general public and is reshaping the provision of ethics education.
The professional piece that we do, the public piece we do, it's always about the education of the human spirit. What we should do and what we can do are very different, and we need to be able to bring those two together. And I'm proud of the work that we've done in the past, and I'm excited about the work that we're going to do in the future.